I have joint pain. Should I take an x-ray? Should I go to a hospital? If you're around my age, around age 40, you tend to have some form of joint pain. It could be nagging, it could be serious, it could be sharp, it could be dull aches. You tend to have some kind of joint pain. Now, the causes of joint pain are multifactorial. And so it's important to know, should you go for an x-ray? Will it help? Will going to a hospital for MRI? Will it help? Or should you go down some more, well, you could say alternative or more holistic approach to fixing your joint pain? No test is perfect. Even the most perfect MRI machine can have different interpretations by different doctors. But this test is a simple way for you to decide your first step. Should it be to go to a hospital, or should it be to go to see someone who specializes in muscles and movement and nervous system kind of treatments? This test is super simple and you can do it at home. Most joints you can do by yourself, but worst case, you can get a family member to help you a bit. I'm going to use my elbow as an example. Let's say my elbow hurts. I don't know if it's a structure problem or a muscle function or joint control problem. If it is a structural problem, for example, a ligament is torn, you need to go for MRI to check out which ligament and maybe go for surgery to fix it. But if it's a muscle problem, all the MRIs in the world will not show much. X-rays will almost certainly show nothing. So, if my elbow hurts, I will do a simple test. I will do a no-load test, which means that I will use my other hand and just bend the elbow with no contraction of any muscle. I totally relax the elbow and I just use the other hand to move it. Full range of motion, fully straight, fully bent. If, when there is no contraction of any muscle, no flexion, no tension, nothing, there is still pain, this is a sign that it is a structural problem. It's a really good idea to go get it checked out with medical imaging. If, however, when I put a load, a weight, or I press against it and I flex against it, or I extend against it in different angles, if those kind of movements give you pain, that means, hey, only when the muscles are contracting, then it's giving joint pain. It's likely a muscle problem, a muscle balance problem, a nervous system control problem, a soft tissue problem. These things you can go and see a therapist who understands these different problems and can fix it. It's unlikely that medical imaging will help you that much and it will just waste your time. There was this one time a lady came to see me for foot pain and I tried everything. I did postural stuff, I did movements and exercise, I did nervous system stuff, I did the sensors of the feet and nothing helped. So I told her to go take an x-ray. After the first x-ray, showed nothing. The second x-ray showed a very small hairline fracture in one of the bones of the feet. And only after going in a cast for a few weeks was it able to heal. So there's an example of medical imaging being really, really useful. But on the other hand, there are cases of people who come to me after a medical image shows nothing. And then we work on all those other factors and the results can be really, really good. In the end, both roads lead to a good conclusion if the person is professional. A good therapist, if he tries to treat you and cannot, he will send you back to get some imaging just to make sure it's not a structure problem. A good doctor, after he sees your image and he says, hey, it's probably not a structure problem, he will refer you to a good therapist. So in the end, there's no real wrong road. But to save your time and money and some effort, you could do this simple test to see which road you should start taking first. Hope this helps save you some time and effort trying to fix any of your joint problems or joint pain. And if you like this, please subscribe to my channel and click the notification bell so you never miss any more science-based health tips that help you fight hard and fight smart for your health.